the ethical framework to accept health risks is mature. It's captured in policy at this point, and you'll be able to find it in the NASA Online Directives Information System. As a matter of fact, the policy and process for accepting extraordinary health risk will be available as soon as it goes through completes its review process. The translation of that and the application of that sort of decision making to the larger mission context is in the concept is in formative stages now. And I think that folks who succeed me in the health and medical world will probably work with the current leadership and future leadership of engineering and safety and mission assurance and the agency to formalize that kind of ethics-based thought in risk acceptance in the future. And that I think will be communicated to the public. And I think the overall effect of that will be to make the public more cognizant of the real risks that we're facing in these away from home missions. And I think we'll end up engaging the public more in the future with regard to being interested in and supporting these human spaceflight missions to cislunar space and then on to Mars. We all recognize that missions to beyond low Earth orbit, to cislunar space and then on to Mars, carry with them increasingly high levels of risk. So at the end of the day, no matter how good we are at miniaturizing and compacting a healthcare system, we will never match terrestrial care or even come close. So there has to be an acceptance of increased risk in order to do these missions. On the engineering side, it's a risk of systems failure. On the medical side, it's a risk of catastrophic health event. So we are working on a formalized ethical approach to risk acceptance in the health and medical world. And we convened a committee of the Institute of Medicine a couple of years ago to look at this very question. How do we go about accepting extraordinary risk that might even be beyond our standards? And what standards are declarations of accepted risk. And the Institute of Medicine outlined a very concise and good ethics principles-based methodology for us to use to accept extraordinary risk. So I think that in the acceptance of the risk across the agency, there will need to be an ethical framework established in which to proceed with these missions. I've talked about that with the leadership of the agency and the safety folks and the engineering folks, and I think we're all in agreement. And I would anticipate that such an ethical framework would be developed in NASA for overall extraordinary risk acceptance in the coming years.